Hi everyone, welcome everyone to our final episode of Women in Medicine series, a virtual event series Credabl is hosting this March to share the powerful stories, insights and experiences of women in medicine in celebration of International Women's Day. Now this is my first webinar that I'm doing, so excuse me if there's any technical challenges today, but I think we'll be all right. My name is Tony Kalmin and I'm part of the Credabl New South Wales team and I'll be your host today. We know that you're not here to listen to me, so I'll go through a brief introduction and introduce you to the two stars of the panel today. We'll be talking with GP and Women's Health Specialist Dr Anita Moss from Victoria, who works in the Royal Flying Doctor Service addressing the healthcare gap in rural and remote Australia. And the other guest this evening is Dr. Anne Clark, who I've known for approximately 20 years. I think I had hair when I knew her last. She became the first female doctor in Australia to obtain the CREI subspecialist qualification in reproductive medicine and fertility more than 28 years ago. For those of you who don't know what CREI stands for, I Googled it, and it stands for Certificate in Reproductive Endocrinology and Infertility. They're obviously both smarter than I am. They've been both on a journey to empower women. And as a father of two daughters, I'm excited to hear about their remarkable stories and their personal, what motivates them. Before we begin, a little bit of housekeeping. This is an interactive conversation, so please feel free to share your questions so we can answer them following the chat. You can submit the questions in the chat and we'll cover off as many as we can. To test out the questions, you can let me know in the chat box actually at the bottom. You can see it's my first webinar. So if you just let me know today who's the woman that inspires you in the chat section, and then we can see if anyone's focusing and listening to me. I can already see something coming through there. So anyway, Anne, Anita, lovely to have you here with us. You've both done an extraordinary thing in women's health. Please let's start, if you can just share a little bit about yourselves, your career background, and what made you choose your specialization. And let's start with Anita.
Thanks, Tony. I feel very privileged to be a part of this panel today. I qualified as a GP obstetrician in 2007 in Western Australia, and I just felt drawn to work with women. At the time, it was mostly pregnant women. General practice has allowed me to continue to do that in the antenatal setting, also looking after women who are having miscarriages, which is it's really feels very special and privileged to be a part of their journey. That's often a very sad journey. And general practice has also allowed me to continue working in a general medical background, which has led me to regional Victoria, where I've worked with RFDS Victoria.
Great. And Anne, I guess same question for you. What made you get started in the profession?
Thank you, and thank you for inviting me. And I apologise to everyone about the purple hair. I'm not quite sure what's happened to the lighting. Nothing to do with Credabl, I assure you. I guess I got into doing what I do by chance. So I was, the hospital I was training at in New Zealand had New Zealand's first IVF unit had started, and the two doctors that had started needed some help. So the powers that be thought that I would be a suitable person to be their first registrar. It'd be fair to say I had a few doubts about that, but it's, you know, when you start to do something you just love, you can't believe you got to the end of the day, and it's the end of the day, and you can't believe that it's got to the end of the day. And I guess how I ended up in Australia was at that time in New Zealand, you finished off your subspecialty training in UK or somewhere, which I was working in London. And then the place I was associated with had some links to Great Ormond Street, the Children's Hospital. And at that time, there was very little option for parents who had genetic issues, and many of them were in the terrible position of having to either not have a baby at all, or else have a baby knowing there could be a problem and things from there. And it was very expensive to do fertility there. So I actually set up the first donor egg program in the NHS. while I was there. And it was because of that that a unit in South Australia was looking for someone, and I was pregnant with my first child at that time, so this seemed a good thing to do, to sort of come and get away from the rigours of London. And here I am 30 plus years later. It was meant to be a gap between going back to New Zealand or going back to the UK, but certainly not going back now.
Well, I'm sure the Sydney community, especially Hurstville where you are, they're appreciative and glad that you stayed here. Anita, you were so inspired by the work that you saw in the Royal Flying Doctor Services. When you were working in regional Western Australia, you actually made a career of it. You've described your work as work of service, and you've created a meaningful life, and this line of work has really made you feel privileged. Would you like to expand on that?
Yes, I have done a bit of locum work in up north, in far north Queensland actually, and North Regional West Australia, and relied on the flying doctors to provide support to fly critically ill patients to city centres to get more treatment. On this side of the country, in far north Queensland, I was working in a town in Cape York that was so small, there was no radiology, very, very limited pathology. So our patients would have to fly to Cairns, which is an hour and a half by plane, just to get an ultrasound or CT scan, let alone any actual treatment. So pregnancy was difficult to manage. They had to deliver in Cairns as well, so that was often tricky. So Royal Flying Doctors were always available on call for support, particularly if I had sick patients. One patient that stands out was a 2-year-old girl who had pneumonia, and she started deteriorating quite quickly. And unfortunately, the RFDS plane had to make quite a number of stops. So we were waiting. We thought they were coming at 6 in the evening. Actually, they didn't land until 10 on the airstrip. So they were there for me to provide advice with ongoing advice in the day with regard to antibiotics and intravenous fluids and other medications to keep her vitals stable. So I was very inspired by them and their support. So in 2016, I did a fundraiser for RFDS Victoria, and I was the highest individual fundraiser. And so I got invited to a cocktail party where they gave everybody a drink bottle, and I just stood up to say a few words about how grateful I am that staff in their organisation always go above and beyond to provide support to doctors in regional Australia, and how I'd always had very positive interactions and support from them. And it sort of led to they asked me to speak about some of my experiences at a few events, and then I was offered a job. So that's how I got there.
Thank you. Now, and you've also been obviously a trailblazer in the reproductive health for a while. What hurdles did you face when you started your career? And I noticed, for example, at the moment, I believe about 1/3 of all doctors are females. Did you, when you started as well, being female, was that a challenge as well?
Not really, or certainly not. Certainly, if you're talking about here in Australia, not the unit I was working in, we had a lovely sort of head of department. He was a real gentleman. I mean, there is sort of like a competitiveness, but I think, the reason why I sort of really went sort of out on my own is I felt like fertility units were getting bigger, and I guess if you sort of think about the change I made, it's always been incredibly important to me, and my early research was around lifestyle factors, things that people could do themselves to make a difference. So, for example, if people's vitamin D or iodines are low, just those two things alone will reduce chance of getting pregnant by 30 to 50%. That's an easy thing to fix. And I guess the other thing that was important to me, which is felt, is I feel like at times people forget the man's half the baby and actually needs half the attention. So in the fertility world, I think the men often get sort of a bit of a raw deal, and it's harder for them to talk about it, and they feel terrible, and they feel like they've let their partner down and it's all their fault. So I guess that's sort of really where my focus has been. And to some extent, I remember the first talks I gave about some of the lifestyle thing, that one of my senior colleagues at the time told me he'd just calculated how much money I'd cost him, because of course sort of a good third of people, if you do some of these things, they never need to go to these sort of more expensive, difficult treatments, and it can happen on their own. So that's, I guess that's where my passion is, doing those things.
No, absolutely. And at the moment, obviously, with this pandemic that's basically, you know, in Australia, we're probably a year through it. It really hit us March 2020. And I was going to ask you, what is, you hear a lot of comments, a lot of commentary about, you know, how COVID impacts fertility, and should people get vaccinated, males and females, potentially will that impact fertility as well? So instead of listening to Koshi or Stefanovic on Channel 9 or Channel 7, let's ask the professional. Do you have an opinion on that?
I do. I mean, because Australia has been very lucky compared to, say, like the US and the UK, so that's why there's been a great holding back of vaccinating women in pregnancy, because all of the studies that we've done specifically excluded pregnant women from them. We certainly know that if a woman gets COVID in pregnancy, that the outcomes for the baby in the last 3 months are not good. The babies tend to be smaller, born early, and things like that. But in terms of if you're not actually pregnant yet, and then it's a really good thing to be getting the vaccine to protect you, not just for women, but for the men, because if a man has a high temperature for even a few days, that can actually completely knock his semen analysis around for the next couple of months. And he might then end up, they go to a clinic and people are saying, you've got a fertility issue. He doesn't. It's just that his body is recovering. So I guess the official advice from the college is, if you're not pregnant, even trying to then have the vaccine. If you are pregnant at this point in time, we're saying to people, hold off because the data's not there. But follow all the safe healthcare things so you don't get it.
Thank you, Anne. And Anita, you obviously differentiate yourself from Anne. Anne offers a personalised fertility service in, you know, south of Sydney, in Hurstville there. And you actually run a gynecology clinic at a small town of Robinvale, which I did have to Google Robinvale. I've got to be honest, I had no idea where Robinvale was. It's a Victorian town of about 3,500 people that provides women with contraception, aiming to reduce the number of unplanned pregnancies. What impact have you made to this community?
It's like many regional centres, it's very under-resourced, and while census data says that there are around 3,000 people in the town, is the centre of Victoria's agribusiness, so stone fruit picking, nuts, and the area attracts a lot of workers, overseas workers. So it's thought that there are over 40 nationalities of people living in the town, and that there's perhaps double the census data in terms of population. So there are a lot of people who don't have Medicare cards and don't have even reduced access to medical services. So we are providing women and families, I guess, offering them long-acting reversible contraceptive methods that there's only one part-time GP in the town. Her books are full and she's doing her best. Our job is to just provide extra support and infrastructure in that setting. So we are really trying to give families more choice about family planning to determine when they're ready to space their children, or if the women are wanting to stay at high school or university or in the workforce and contribute more to their families financially and to the community economically. It provides more of a choice. Otherwise, their option is to go to Mildura. There's a 3 to 6 month wait to see the gynecologist there, which is tough. There's one bus a day out of Robinvale to Mildura, and if that woman has children that she needs to pick up from school, that provides a real challenge to actually get to her appointment and get back. It's quite a disadvantaged town, and there are a lot of social issues as well. So it's having quite an impact.
No, absolutely. My Victorian colleague, Chrissy, said you do an amazing job there, and particularly in the Aboriginal community as well. It's incredible what you do there. Now, speaking of giving back to the community as well, 2019, you spent a week in Fiji, Anita, with a team of 15 doctors, midwives, nurses performing 400 cervical screening tests in this time to a population of women that wouldn't have had access to this important preventative health measure. Where do you get the motivation to do everything? And your 9-year-old son, Harsha, was involved in that. Most Australians just go to Fiji to lie under palm trees and sip a pina colada. So incredible going there for business, work, helping, giving back.
We are so blessed in this country to have the social support system that we have, Medicare, to be able to have national screening programs for so many preventative health measures. And that project was not mine. I was simply a worker bee accompanying Nicola Fitzgerald, whose project it was. It was her second of 3 trips before COVID hit. And it was a real privilege to be a part of that. So I think we were screening about up to between 60 and 75 women a day. Sometimes the bus trips from where we were staying, it was 3 hours there, 3 hours back, running samples on a makeshift lab in the bus, including a colposcope where the gynecologists were looking at some of the women who had, abnormalities. My little boy, Harsha, came with me, took a week off school, and he actually ran the samples from the clinic where we were out to where the bus was, to the makeshift lab. So it was nice for him to be able to be a part of that too. It was very special. The women were incredibly appreciative. The gynecologists who've set up that program are extraordinary.
Amazing. You haven't been nominated for Australian of the Year award, but and you're also a very giving person. And I know what even I've known you for a good 20 years or so, and a lot of my work colleagues, particularly female, I know have actually, they haven't made work appointments to see you. You've always been there to take phone calls. You've come and presented lunch and learn lectures in our staff to give free advice, always helping people out, staying an hour afterwards to help out on questions. I've known you since you were probably in about an 80-90 square meter premises at Hurstville. I think it was the Calgary office, Calgary Hospital for memory, with a staff of 3 or 4. And you've grown where you've converted 2 large houses in Hurstville. You've got a staff of nearly 30. And it's incredible, the growth. Now, I guess my question to you is, if you want to talk about how you've grown your practice, and if there's any younger aspiring doctors there, if you want to give them a little advice in how to grow your practice.
Okay. Well, I guess the main thing that I'd say is that the important thing is to treat people how you want to be treated yourself. And then that's not just the people that are coming to see you, but it's also the people that you're working with. Because really, if you don't have working with a strong group of people, so this is fertility is very multidisciplinary, so you need embryologists, you obviously need nurses, you need counsellors, admin. So my workplace, they're all female, and part of, I guess, what I also want to do is to make it a place that I'd like to work in as well. So majority of them, they work flexible hours, they have children, so therefore they were working part-time. So to try and, but I guess from my perspective, I think the things, if you're going to have a practice, then it needs to be doing things how you'd like to be treated. I think obviously you've got to, I guess, believe that what you think's important, other people are going to think's important. Not everybody might think it's important, but I'm not trying to rule the world. And I think sort of give everyone in the team sort of their head so that they sort of feel involved, that they're all equally important, which they are. And I mean, I think unless people have satisfaction in their workplace, if they have satisfaction, then that flows through into how they deal with everyone else that they're looking after as well, I think.
No, thank you. Now, I've been told at these webinars that there's a lot of fairly shy, introverted listeners. And so if there's any questions out there, I don't know if there's any questions that have been put through in the meantime. Anne or Anita, have you, this is fairly spontaneous, but if any of you got a question for each other as well? Whilst I'm looking to see if anyone's written a question.
Have you written one? Have you written a question, Tony? I guess you've written the questions.
Well, I wrote a question that I've already asked. If the audience members wanted to put something in there, you know, nothing's come through at the moment. But you know, I guess a question I'll ask is, in fertility and in the last 4 or 5 years, is there any standout progress that's been made? Is there any single item that listeners would appreciate, would you think?
I mean, I think, I mean, one of the massive changes in fertility, and particularly if you're looking IVF, I guess one of the big changes is that you don't need IVF for this to happen for most people. But the other interesting thing is when IVF first started, if we're doing that was started for women with tubal disease. It's so rare now to see sort of someone who has damaged fallopian tubes from infection. So really the main single reason that I think people now have IVF, it's not recognised, is to do with male factor. So it's switched from actually being something to treat women that had sort of something that really, in terms like, as Anita's talking about, sort of better management for women and things like that, and recognition that the indication, certainly in this country, for IVF essentially no longer exists. But it's now made possible for a whole lot of other couples, particularly in the past, when sort of the couples before would have had to have looked at donor issues, don't need to do that. And I think people forget that sort of fertility, IVF in particular, is quite an old technology. It's been around now for, I mean, Louise Brown is now over 40, so people think of it as being new, and it's constantly sort of evolving. But at the same time, I feel like sometimes people forget that all fertility medicine is an introduction agency. You can't make people's babies. Yes, you can make sure the egg and sperm get as close together as possible, but it's still going to be up to them if they decide to become a pregnancy and if that embryo will hatch out and implant.
Thank you very much. And if anyone wants to see more of Anne, it's www.fertilityfirst.com.au. Now, Anita, just one last question to you. I mean, you've virtually done everything that giving back to the community, Royal Flying Doctors, Royal, you know, communities, Fiji. What's next for you? Are you going to climb Mount Kilimanjaro or anything else planned?
Well, no, but I think my current passion, if you like, I'm currently on the RANZCOG Wellbeing Working Group and looking at improving ways to support members of the college, trainees, practicing members of all stages of their career, and also all around Australia, particularly those who are in more isolated places. So I am sort of hatching an idea at the moment about providing that kind of support to medical students. So I do teach a little bit at our local public hospital, and I think a lot of us that have been out for a long time, and certainly like you, Anne, you would have a wealth of experience that, you know, you could talk about to sort of just share how things that worked well or didn't work well, or things, different ways that you feel, you know, might support someone's journey through medicine and beyond. So that's my current little project.
Well, thank you very much. The two of you are both a credit to the profession, to women in medicine, to your families. Thank you very much for all what you've given back to the community and to the profession. So I'd like to just obviously thank you both, and everyone else there. If you'd like to see any of Credabl's previous webinars, and there's a growing list of them, please have a look at the website for all the blogs. And unless Anne or Anita have got any final comments, I think that will be it. So Anne, Anita, anything else?
No, thank you.
Thank you.
Thank you very much. And Anita actually had her vaccine jab today, and she thought she may be a little all over the place. Well, you've done very well. So there's obviously no side effects. So thank you very much, everyone.
Thank you.
Thanks. Bye.
Bye.